So at this point, we're going to open the conversation up to all of you. And because this is being recorded, you will need to speak into the microphone. So if you'd like to ask a question directed to all of the panelists or to one panelist in particular, please stand up. I'll bring you the microphone, and then you can ask your question. Okay?
Well, I'm not sure who's best to answer this, so I'll just put it out there. I was listening to all of you, and you were talking about the uninsured. Are all of the clinics, all the safety net clinics open to the uninsured?
Yes and
yes.
no. In theory, yes, but some have more capacity than others to take the uninsured. So when people call our office, I usually find out a few questions about where they live. Some people take uninsured patients, but only from certain zip codes. Others would like to take uninsured patients, but at the moment they just can't do it.
Like Rosewood, yeah.
So
we have to create a safe environment for our patients. So if we take on and open up our doors, and the floodgates will open, believe me, it won't be a safe environment for patients. And then there's limited access for an appointment if you overindulge the panels. And panels are the amount of patients that the providers see. And we have a certain amount that each provider can see, and to keep our access available for our patients. So you wouldn't want a patient to call up day after day after day and not be able to get into the clinic because there's too many patients to be able to provide an appointment for them, literally, so you have to keep it at a certain amount.
And then even the uninsured they would pay something when they came in, right?
Certainly. The uninsured, we ask them to bring in proof of their income. If they don't have proof of income, we have a letter that they have signed by two people that don't live with them, and then they also sign another form. And if we're ever audited by the government, that's their proof of income. So, yeah.
Okay, I just have one more question. Sorry. You were talking about preventative services. Somebody who has been on unemployment for 2-3 years, had insurance but no longer has insurance, hasn't seen a doctor in 2 or 3 years, doesn't necessarily have a chronic condition, but also would like to have, the blood checked. Maybe they created a condition. Who knows? Is there a clinic that would do that? Just come in for preventative?
yeah,
Mm-hmm.
yeah, definitely.
Rosewood does do that.
Okay.
We also extend, or actually PAML, the lab that shares our clinic with us, it's an on-site lab. We have extended the discount, the sliding fee discount to the lab. So they also, a patient can get 75, 50, or 25% discount depending on their income level and the size of their family. So the labs are discounted as well.
So just speaking in general about a lot of the coalition clinics, a lot of them try to be primary care homes for their patients. So it's not just acute care where you're sick right now and you need to see a doctor now. They really want to have patients be able to come back to the same physician or to the same clinic at least and have that relationship with the community. And as far as the payment goes, we do have some clinics that, like I think Dr. Sanders mentioned, there's a recommended donation, and we really appreciate it, our clinics do. But if someone comes and they can't make the payment, no one is going to turn them away.
Our sliding scale goes down to 0 for people who have no income. I think that's the case at some of the other places. Like Genevieve was saying, a lot of us are working on what they call this primary care home model, where we're really trying to engage people in relationships over time. Because when we look at part of what's not working with healthcare in this country, part of it is because people wait until they're really sick and then they end up just going to the emergency room, and a condition that maybe could have been resolved with $10 worth of medication has gone untreated for so long that now it's going to require a $100,000 hospital stay. And so we want that person to come in for that checkup, but we want them to then stay in a relationship with us. We want them to keep coming in, even if they don't feel like they need it. We want you to come in and get that annual flu shot. We want you to get the cervical cancer screening and the mammograms, whatever other kind of preventive care that we know is going to be effective in preventing more costly or more problematic issues down the road. But it is a balancing act, because when we all start moving into that model, then that's less capacity for people who just have something that popped up. So we're going to be trying something new this summer. We're going to be expanding our hours later into the evening, and in those evening hours we're going to start doing a hybrid of sort of the kind of primary care we have been doing, but also some urgent care, and provide some capacity for the downtown area, and so the folks who do just have something that came up and they've never engaged in care anywhere can come in and get that seen, with the hope that then once they've come in for that urgent care visit, we can then get them into an ongoing relationship where maybe they'll start coming back more often and be able to deal with some other issues other than that urgent issue. But that's a big part of what we're all going to have to do to help the health system as well, is we've got to take the pressures off the emergency rooms. Mm-hmm. There's a lot of people going to emergency rooms that don't need that level of care, but it's prohibitively expensive, and that's part of what's driving up costs in this country. And so if we're treating sore throats and ear infections and a little cut that could be sutured in a doctor's office, if we're doing all that in the emergency room, we're paying for these expensive hospital facilities when they could be used more appropriately. And so we've got to find better ways of treating some of these urgent issues, but not treating them in an emergency setting.
Thank you.
You're welcome.
I just want to thank you so much for what you're doing. It's unbelievable, the stories you've told. I think it comes alive when people actually hear it. And I'd like to direct the question to Dr. Sanders. Mm-hmm. And you said something about being able to be on the reimbursable category. Mm-hmm. Is that just at the state level, or are you having problems getting reimbursed at the state level?
It's both a statewide and a national issue for providers of what's known as alternative medicine. Yeah. In the state of Oregon, naturopathic physicians are licensed as primary care physicians. Sure. We have the ability to prescribe any pharmaceutical medicine that you might need, but the third-party payers have the right to not panel us as a class of providers, and so that puts a barrier to patients like yourself coming to see me as a naturopathic physician, because then you have to pay out of pocket for me because your health insurance doesn't cover it. There's a variety of health plans that do cover alternative medicine, but they might cover only $1,500 worth of care a year. They might cover only 6 visits a year, or they might cover you to see me for anything that a medical doctor wouldn't do. So there's all sorts of little caveats about the third-party reimbursement for naturopathic physicians, especially, and it's nationwide. So it's something that we're working on both a state level and a national level as well. And we have a lot of supporters in the Oregon legislature. And when you guys have heard about the coordinated care organizations, the coordinated care organization legislation has in it language that is pretty strong language that prevents the discrimination against any kind of provider. They were going to kind of use the not very strong language to say, you shouldn't discriminate against providers, but the language is actually much stronger, and we were able to get some pretty strong language in. So when a coordinated care organization is formed, hopefully they will begin to include naturopathic physicians, acupuncturists, chiropractors, other alternative care providers that can really help provide services that are less expensive and can be more effective for a lot of conditions, a lot of chronic conditions.
Could I ask one more question?
Oh, certainly.
Yeah, have you heard anything about art therapists? And because these are counselors who
Mhm.
also provide art therapy within hospital settings,
Mhm.
inpatient settings, are they going to be recognized and included with this whole new process?
I don't know. That's a really good question, because I know that art therapy and music therapy, they're taught here at
Right.
Marylhurst. Yeah, and I have a friend who went through the music therapy program, and I don't know the answer to that question. Oregon is kind of a funny state when you talk about therapy and counseling, because you don't have to be licensed to be a counselor in Oregon. But I don't know what that does in terms of reimbursement, because I'm not as familiar with the professions.
I know in our mental health programs, I think we can get some reimbursement for art therapy. That's
Mhm.
something we've used. And I just wanted to echo what Dr. Sanders was saying about the naturopathic services. That's also a problem that we've run into at Central City Concern. We have naturopaths who are primary care providers, and we've been able to get one of the larger managed care companies to reimburse us for those services, but then there are other managed care companies that refuse to do that, and it's a real struggle. We find that the care is just as good at, as in some cases better than what the traditional doctors are doing. And it's also a really important engagement tool, because for a lot of our folks who are in recovery from drugs and alcohol, they've made commitments to themselves to be drug-free. And for some of those folks, that includes allopathic medicine. They don't want the little purple pill. They want to find more natural ways of staying healthy. And they would much rather work with one of our naturopathic physicians and work on diet and, if necessary, some herbal supplements and other interventions that way, rather than just getting a whole bunch of prescriptions. And so it's a really valuable tool for us to have, but we do run into some of these reimbursement issues. I mean, we've done better than what they've been able to do as a freestanding naturopathic clinic, but it's definitely an issue. And what I'm hoping actually that they'll address in the legislature in this coming session, because I'm hoping the language in the CCO legislation is going to be strong enough to really prevent that kind of provider discrimination we've seen. But I think probably even stronger language would be nice to get passed.
I'd like to add that, talk about a barrier. That's a real barrier for patients too. When they have a limited benefits package, it's they have through the Oregon Health Plan, depending on the diagnoses, if it's above the line or below the line, and it really ties the provider's hands when it comes to trying to help the patients. So, vote.
Are most of your services just available to Multnomah County or Portland City residents? And if so, where do people, say, Clackamas County, or I know that in Hillsborough there's quite a good amount of care out there, but in Washington County and Clackamas County, what do people do?
So the coalition clinic groups actually, many of them only serve certain parts of the city, so that would probably be Multnomah County. But many of our clinics do not require any proof of address. People can come from all over the Portland metro area. We get a lot of calls from people in Clackamas because there is such a lack of healthcare resources out there. It's pretty hard. And so if people are willing to drive, I can refer them to clinics that are located far enough east that they can get to fairly easily, depending on what needs they have. But yeah, we get calls from all over Oregon, really, because especially once you get out of this metro area, there's a lot of need, and there just aren't any clinics.
Yeah, there's a just an overall primary care shortage in rural Oregon, and then when you think about people who are on Medicare, Medicaid, there's an even greater shortage of primary care outside of the metro regions.
We do have people come to us from all around the area. We've some folks who come from as far away, St. Helens, Astoria, farther out, East County, Clackamas County. But it's, we're located in downtown Portland, so that's a big sort of transportation problem for them. There are the neighborhood clinics. I'm trying to remember the name of the ones that came working open, neighborhood health clinics.
Mm-hmm.
They opened up one in Gladstone, and I want to say they opened one in Milwaukee, but I think they've got 3 now in Clackamas County.
Yeah, we see all counties, and we even see, we're able to see patients from Vancouver on the CHIP program, because we're part of Yakima Valley Farm Workers Clinics. So the closest clinic in Washington for them, I think, would be like Prosser. So they are allowed to come to Rosewood because we're part of that organization.
Yes, I'm curious about the scope of unmet need out there. So each of you could estimate, if you had an unlimited budget and unlimited volunteers, how many more patients could you see a year compared to what you're seeing now?
That's a great question. Our clinic has, let's see, 3, 6, 9, 12, about 15 exam rooms. So on any given day, we can have 6 providers working and be able to comfortably get those patients through their appointments. If we had all 6 providers, which we're working on, we could probably see, I would say, we see about 1,500 to 2,500 a month. We could probably see about the 2,500 every month with the 6 providers.
Yeah, if we didn't have to worry about space, money, whatever, if we're just looking at the number of people trying to get in, I would say probably we bring in another 1,000 patients easily if you look at the number of people who get turned away for one reason or another during the year. And that's just in primary care. You look at some of the other programs like Hooper Detox, they turn away probably 20 to 25 people every single morning who are trying to come in and get off drugs and alcohol, and there's just not enough space in there for them. So, yeah, I think if you looked across the city of Portland, I think you're looking at probably 6,000 to 10,000 people easily who aren't able to access care right now who need it.
I think it's probably less about our capacity and more about the things that Genevieve was talking about, and those things that get in the way of people getting to care, whether it's transportation, language, money, those kinds of things, keeping a bunch of people that we may not even know about not getting in for care.
Just so you know, our numbers have continued to rise. If we're looking at the number of patients that our clinics saw last year versus the numbers they're seeing this year, it's a steep rise. It's only going